Good morning, everyone, and thank you for joining us for Building Networks for Change, Autonomy, Advocacy, and Allyship for LGBT Older Adults. This is the third installment of a set of trainings that were developed for the Outreach Advocating for Safe and Inclusive Spaces for LGBT Older Adults initiative developed by the Outaging Committee that is housed at the Pride Action Tank, also known as PAT. I'm Kim Hunt, Executive Director of PAT, which is a project of AIDS Foundation Chicago, where I also serve as the Senior Director of Policy and Advocacy Operations. Unlike our previous Outaging trainings, where all the attendees were LGBT older adults, this training is for that group, as well as anyone who has an LGBT older adult in their personal lives or works with older adults as their paid job. For this latter group, we are fortunate to partner with the Center on Halsted, and they are offering 1.5 CE credits that will be awarded at no cost to social workers and professional counselors. The overarching goal for this morning's program is to provide LGBT older adults and their allies with tools that improve their autonomy and agency in housing and senior programs. We also have 3 practice-driven objectives. 1, to provide information about the rights of LGBT older adults, including the Equity for Elders Act. 2, to develop an understanding of the role of allies and how to show solidarity in healthcare and other settings. And 3, to show the importance of continued advocacy for LGBT older adults through public policy. We're going to be using Zoom webinar. So unfortunately, we can't see your lovely faces and you're on mute. Although there will be time for Q&A near the end of our training, feel free to drop questions in the Q&A portion and as well as converse with other attendees in the chat throughout this training. We will be monitoring both to make sure that we capture your questions and your thoughts. So we are fortunate to have some fantastic trainers today who many of you have worked with in the past. They are Jackie Boyd from the CARE Plan, who will talk about advocating for self and others in healthcare and other settings. Britta Larson of the Center on Addison, who will discuss housing and housing rights. And Mike Ziri of Equality Illinois, who will talk about the implications of recent legislation that adds LGBTQ and HIV status to the definition of greatest social need. They'll each say a little bit more about themselves before diving into their topic areas. Getting us started, though, is Will Wilson. And I've had the pleasure of seeing Will's advocacy in action over the past several years through his work with AFC's Illinois Alliance for Strong AIDS Policy, otherwise known as Illinois ASAP. And I got to know more about Will when he joined the Outreach Storytelling cohort last fall. I think, and others in this program think it's so important to hear and be directed by the stories of the people that we serve. And with that, I am going to turn it over to Will to get us started.
Good morning, everyone. As Kim said, my name is Will Wilson. It is a pleasure to be here this morning and to speak with all of you. I am honored beyond words. And it's kind of ironic that the topic for today is on housing. Originally, when I met Kim in the fall for the storytelling workshop, I had talked about the concept of communications, but in my own personal life, over the course of the last year, I've actually experienced a major housing issue. And I figured that that would be far more appropriate to share with all of you. So I'm just going to tell you what my last 12 months have been like, and we can take it from there. So like most of you, I started off the pandemic aware of the fact that we had a crisis in front of us and we were going to have to deal with it. There were certain things that we were going to have to do, but overall, I was feeling pretty self-contained and maybe even a little smug. I'm old enough to have lived through the first pandemic, which we referred to as an epidemic, and that was the HIV infections of the 80s, and I've survived that. I'm living with HIV, been living with an AIDS diagnosis since 2002. But, I hit the first of the year and I was aware of it. And as time went on and I could see that the administration wasn't doing anything about it, I became more aware of my own personal responsibilities and how I was going to have to deal with it. And fortunately, I was working for an employer, Starbucks, who also took that into consideration. And I live in a state where our healthcare is a big concern. So again, I was feeling overall pretty self-satisfied and smug, if you will. Didn't take long after March 15th for me to figure out that our ideas about public health and how we approach them can differ greatly, even among people who live under the same roof. It was then that I discovered at the beginning of the state lockdown that my roommate / landlord and I had two totally different perspectives on how to deal with public health issues. I was taking this thing very seriously and keeping my contacts down to a minimum. And my roommate was answering booty calls as if life was pretty much the same as it had always been. And for the most part, didn't like it when I called him out about it, and suggested that maybe he needed to pay a little bit more attention to the fact that he shared a residence with somebody who was in a high-risk category and that I had major concerns about this. Well, the upshot of it was that he felt that I was disparaging him and he refused to talk to me anymore. In fact, the only way that he would communicate with me was via email, and the only topic that we could discuss was rent. Now, mind you, I lived in the same space as him, had my own bedroom and bathroom, but we shared a kitchen, living room, some general areas that we shared. It was a duplex, so he was on the lower level, I was on the upper level. For the most part, spring went along just fine. I got used to not being talked to, although I will admit that over the course of the summer, it was a little strange to take a walk or go out for a bike ride, come back and want to say something and have somebody not even look at you, and just completely ignore you. The pressure began to build, and the stress of being ignored while I was in this living space was starting to, I'd say by June, it was really starting to get to me. Well, sometime during the middle of the summer, I got an email, I'd say it was the middle of July, accusing me of leaving the burners on the stove and going out and leaving the doors unlocked. And the reality was I wasn't leaving my room except to go to the bathroom, which was right next door. And the only time I would come out of my room was when he wasn't in the apartment, which during the summer months was not often. He was home quite a bit. He works in the education system, so he was off for the summer months. And so I didn't really see him, and I pointed that out to him. But it caused me to reach out to friends of mine who are legal experts, and I said, what do I do about this? Because these accusations are wrong, and I feel like I'm being gaslit here. How should I handle this? And I was told, just pay attention to it. So life continued on, and then in September, he told me that he wanted me to move at the end of the year. It was in the fall that Kim held the first storytelling workshop, and it was during that workshop that I found out about the Center for Disability and Elder Law and the Equality Law. So as time went on and I got this email telling me that I'd have to leave, I reached out to them and said, how should I deal with this? What should I do about this? Here's what's been going on over the course of the summer. And I was advised to just pay attention, keep track of what was happening. If I was getting emails, to keep a copy of those, anything else, to just keep a record of it. As the winter months came on or the fall got cooler, we started playing with the heat. It never hit the city standards in my room. I actually got myself a thermostat. So I was always a little colder at night and a little colder during the day than I needed to be. I just put on extra clothes. But again, I was marking this kind of stuff down just to see what was going to happen. The fall continued. We get to New Year's Eve. The due date that I was supposed to be out, I had something lined up. It fell through. So it's December 31st, 2020. I have to move and I have no place to go. And he's expecting me to be gone the next day. So I have to tell him that I'm not going to be able to go. And, I'm doing the best that I can. And he's aware of the fact that legally he can't do anything. But that's when the passive aggressive behavior really, really started. If I tried to go out and use the kitchen, I'd have to clean first. If I would always have to worry about people coming in. There were always people being invited over. In fact, during the holidays, he actually had people over for meals and a little partying. And of course, I was trapped in my room. It began to feel like a prison, and I wasn't sure what to do. So I started reaching out. And the agencies that I called, the first question that I would be asked was, "Are you homeless?" And I'd have to say no. And they'd say, "Well, until you're homeless, we really don't have anything to offer you." And I was like, that can't be the only solution to this problem. So I was actually on a webinar with a state senator, Senator Feigenholtz, and she said, "My office is open all the time if you have any questions." So after thinking about housing programs and the fact that they could help me if I was homeless, I thought there had to be something else. Let me reach out to a local legislator, a state legislator. So I reached out to Sarah's office. They advised me to reach out to a local legislator, my alderman. So I called Tunney's office. He is the alderman in the district or the ward I now live in, but at the time it was the ward that I wanted to search for housing in. And I asked if there was somebody there who could help me locate housing that was designed for seniors, that was either Section 8 or had reduced housing or that was just available. Did she have a list? And it turns out that she did. She sent me this list for not just the 60613 zip code, but also the 57 and I think one other zip code, but quite a lengthy list. And these were all places that I was eligible for. So I started calling around. Well, it was the second call that I made. And it turns out that as I talked to the person, I discovered that I was eligible for another program that was not Section 8, but it was reduced rent, which I could afford. And she had something available. So I made an appointment to come down and see her, filled out the applications. But it was then that I discovered that there were more options. And so after I got the lease for this place and moved in, I hooked up with AIDS Watch. They asked me to speak at AIDS Watch, and I started sharing my story with federal legislators and with the folks at AIDS Watch. And that's when I discovered that a lot of agencies have access to at least knowledge of programs that are available for seniors and LGBTQ seniors, as well as folks living with HIV, that are more than just Section 8. Unfortunately, agencies may not have access to that information or may not be able to access it because the feds haven't put in the money. So I was all over the feds about increasing the budget for HOPWA from 425 million to 600 million because this way they can get more of that information out. And I figured that we have to do our part of sharing that information with seniors. I mean, I have a responsibility to share my story with you guys so that you know what I went through. And my thought about that was that if I, as a white man with all of the privileges that come with being who I am, still had to run through the kinds of challenges that I faced, I cannot even begin to imagine what a woman of color, a transgender individual would have to begin to deal with to even find out this information. So I think we need to work at it from both sides. But again, I am truly honored and privileged to be able to share all of this with you in the hopes that something that you might learn from me will help motivate you to reach out to others because we can make this world a better place. And this is the only way that we're going to do that. So I want to thank you again for taking the time to listen to me. And I guess I turn it over to Jackie.
Jackie, you're on mute.
Well, thank goodness I didn't say anything important yet. Good morning, everyone. And thank you so much, Will, for sharing your stories. I feel like in the pandemic, so many service providers are just trying to keep it together day to day, that understanding how the needs for the communities we've served have changed, are changing, will change as a result of the pandemic. It just can't be understated. So thank you for being here today and for sharing your story. And everyone who's out there, I'm Jackie Boyd. My pronouns are she, her, they, them. I'm the founder of a company called The Care Plan, and I've had the honor and privilege of being a caregiver for over 20 years at this point. When I started out my career when I was 18, working in nursing homes, I managed a home care agency for 12 years and then started my company with the express goal of building more resources for LGBTQ plus and Black and Brown older adults. The key takeaways today that I want to be sure we touch on are the importance of seeing our seniors. The biggest issue that I had in aging services, both when it came to working with LGBTQ plus older adults, working with people who are at or below the poverty line, and my Black and Brown community, is that folks aren't seen within aging services. I find it hard now when I look back on an industry I had been a part of for so long that there was no rainbow flags. There was no one talking about gay and trans aging. There was no specific outreach to the communities that I was a part of. It was like I was living parallel lives. And I don't want that to be the case. Our world is much more nuanced than that. We each are much more nuanced than that. So I really think advocacy, effective advocacy, starts from a place of awareness, of raising up and lifting up stories like Will's, of embracing and building inclusive cultures within our services, whether health, aging, or otherwise. And on a personal level, not being afraid to show up and advocate actively. So that's some of what I'm going to be covering today. And I think it's important that we clarify who are LGBTQ plus older adults. And if you are lesbian, gay, bisexual, transgender, and over the age of 50, please don't get upset with me. This is not my personal opinion. This is what the research tells us and the conclusions that I draw from that research. We see that 41% of lesbian, gay, and bisexual people at age 50 have a disability or are dealing with a chronic illness. That means that almost half of this population, and that's just lesbian, gay, and bisexual, for trans folks, we see that number is 65% by age 50. So that means that we need to be ready. We need to be ready to show up for each other as queer folks. We need to be ready to support our LGBTQ plus older adults. And we need to be ready to think creatively about the aging process because the lived experience is different and the aging experience may very well be different. It's important to recognize that LGBTQ plus older adults often feel invisible or unsafe in healthcare settings. And it makes sense, right? I just shared that as a provider, I was in the field for 15 years before I started my company and started to connect with folks like Britta and folks like Pride Action Tank to say, hey, I too want to be part of raising awareness about what's happening for LGBTQ plus older adults and making the world a safer place. But it's important for us to remember we are all people first, and that doesn't change as we age. I actually think one of the isms that doesn't get the attention it deserves is ageism, and the way that can strip away the identities that are most important to us as we age, right? If I think about the questions that seniors get asked about healthcare, about housing, it comes down to a few things. It comes down to basically how much money do you make and what's your health profile? What's your level of care need going to be? And can you afford to live here? And if I was to ask any of you what was important about you, I would bet that those things are bottom of the list. You would not want to tell me your healthcare conditions, and you would not want to tell me what your financial situation looked like. You would want to tell me about who you love, who you spend time with, what you've done in your life, what you're passionate about. Those are the things that make us who we are. And so I think for anybody who's trying to be an advocate, just remember, we are people first. We are not just the trauma that we have overcome. We are also the triumph that we create in our lives every single day. There are so many strengths for LGBTQ plus seniors, and this is an area that I personally am so excited to continue exploring. As somebody that does care planning professionally, I'm always thinking ahead. I'm always thinking about how can we be creative about aging and look forward to it and claim aging. And I think this first generation and these first few generations to age out are really uniquely positioned to do it on their own terms, to age on their own terms with their own resources and leveraging cultural traditions to be sure that we are well as we age. So some of the strengths that you may or may not know LGBTQ plus seniors have are resilience, right? You heard Will say, I was kind of approaching this pandemic from a place of lived experience because I have already been part of a pandemic. And there was loss associated with that and pain associated with that and years potentially of trauma associated with that. And there's also the living through it. There's also the resilience. There's also I overcame that. I can overcome these other barriers in front of me. Advocacy and mentorship, LGBTQ plus folks are more likely to be mentors than their non-LGBTQ plus counterparts. And I always take so much comfort in that because this is, again, a generation that really was in the streets around civil rights, women's rights, gay rights, trans rights. And so leveraging that and recognizing that in older adulthood is so important. There's so much value to continuing that tradition of advocacy and mentorship. I find that LGBTQ plus older adults also have a really deep connection and commitment to anything they put their minds to, whether it's family or friends or civic opportunities like this to advocate or to show up and be part of one of the groups at Center on Halstead. I'm sure Britta can speak to the fact that that Voices group has people that have been there for years that continue to come back and continue to commit to each other, to support each other and share their stories. And I think one of the unique strengths that LGBTQ plus seniors have is chosen family. And I know this session is not just for providers, but for folks who want to know, how can I show up? What can I do? You may be someone's chosen family. You may be that person in their life that is a close friend, where there's years of trust between you, or where there's a pattern of showing up for each other between you. Chosen family are oftentimes the people that come in to provide that advocacy, provide that support at all stages in the life of an LGBTQ person. It might start for someone when they're young, if they had housing issues or challenges in their family and needed to sleep on a friend's couch or multiple friends' couches, or have some money, financial support for their wellness or to eat. It might have shown up in midlife with major things happening like commitment ceremonies or weddings or births or adoptions. And at end of life and in the older years, I find that chosen family shows up in really unique and beautiful ways. I have a client that we work with. They're a couple. Well, they used to be a couple. Now they're exes, but they had been partnered for about 20 years, fallen out of touch. One of the women got an unexpected diagnosis and actually became bedbound over a span of time. Her ex-partner showed up for her to the point where she moved her in and has been her primary caregiver for the last 2 years. Unpaid, unasked, unrequested. She just felt like she was the only person that could show up, and that's how she showed up. So there is just, I cannot tell you the strength that our LGBTQ plus seniors have, and I see it, I'm blessed to see it every single day. There's a woman named Marcia Wetzel who passed away this year. And I just wanted to lift her up because she was one of our clients. And I know Britta had a lot of connection with Marcia too. Marcia is somebody who experienced housing discrimination firsthand and is a perfect example of that self-advocacy that LGBTQ seniors are often accustomed to. She was in an assisted living facility after having cared for her partner of 30 years, who then passed away. Marcia was looking for housing because the home that she had been in with her partner, the family kicked her out of. So here's this elderly woman. She just lost her partner of 30 years, lost her house, lost her family, gets transitioned into an assisted living facility. And after she comes out and starts to share a bit about herself, experiences verbal and physical harassment and abuse. And Marcia's story, I think, is really a lesson to us all because the facility had not seen LGBTQ plus seniors. It wasn't that they had animosity. It was that they hadn't even been aware that someone who was lesbian, gay, bisexual, or transgender may be in their community. And so we're unprepared. When the residents started harassing Marcia, the staff didn't know what to do. And so there's a whole case that you can look up that Lambda Legal represented Marcia on to basically, under the Fair Housing Act, say, no, landlords are responsible for discriminatory practices that they allow to happen within their home. So I think there's, on the other side of challenge is opportunity, is the way I look at it. And Marcia was a perfect example of that. She used her voice throughout her life and she made real change. So never underestimate the ability of the LGBTQ plus seniors in your life to shake things up, because they will. As a practitioner and as a friend, I think it's really important to remember that resilience comes from someplace, and that my LGBTQ plus clients and older adult friends have probably experienced some trauma in their lives. And so I want to approach them from a place of trying to create deep trust, ensuring that they feel safe, having a collaborative perspective and a collaborative approach, making sure that choice is always front and center, and that they feel empowered. This is something I strive for in every single interaction. It starts from as soon as I get that first call. If I'm free, we are on the phone for as long as we need to be, so that I can fully understand what's going on with you, and you have all the time in the world. Because we know in healthcare, that's not how it feels. You are always on a timeline. And so even that, feeling rushed about your vulnerability and your healthcare, is stressful, and it makes you not want to share your story and not want to be proactive about what's happening. So I think there's a million ways that you can use a trauma-informed lens. That's just one example. It starts from the first point of contact of how you show up, how present you are, ensuring that you're affirming the relationship and affirming the person's choice to invest in you and to share their story. I'm going to share just a little bit about terminology because I want to be sure that folks understand, who maybe are coming to this for the first time, understand the difference between some of the terms you might have heard. So when we're talking about LGBTQ plus communities, we are talking about a whole group of communities, not just one experience. So for example, the experiences that folks have who are lesbian may be different than the norms that are present in gay community, may be different than the norms and experiences of people in trans community, may be very different than the experiences of folks who identify as bisexual. So there's so much nuance, and our language is limited, but it is also always changing. So brass tacks. When we're talking about sexual or romantic orientation, that's an external orientation. That's about who are we attracted to? Who do we want to spend time with? Where do we want to create those intimate connections? And you'll see the list on the left-hand side of the screen. That includes lesbian, gay, bisexual, queer, pansexual, same gender loving, questioning, asexual, polyamorous, and the list goes on. The second column is about gender identity. So sexual orientation is about the external orientation of who we're attracted to, who we want to spend time with. Gender identity is internal. It's very internal. It's about who am I? What is my gender identity? And how do I want you to identify me? So when we're talking about identity, we're talking about being cisgender, transgender, non-binary, two-spirit, genderqueer, gender variant, gender expansive. I promise you there are more words than I could ever put on a whole slideshow. So if you ever feel tripped up, if you ever are like, gosh, that's the new term, or I don't understand that term, please don't be hard on yourself. Just do your work and Google and find the way to understand what those terms mean, because language is constantly evolving. And in this era where we have a little bit more freedom, there has been an explosion of new language, and there will continue to be. The young folks I work with, goodness, they make me feel my years because they are always coming up with new terms. And then when we're talking about anatomic sex, that's what we're talking about on the right-hand side. Some terminology you might hear LGBTQ elders use are things like family, friend, this is my roommate. And again, thinking about how important this training is, I was reflecting today about all the elders I served before I started the care plan, who used that term, who said, this is my roommate, this is my friend, because they never felt comfortable to be out. So how can we know how to show up for them and to meet their healthcare needs if they can't even share the most intimate relationship in their life? It really does affect healthcare outcomes and how people access or don't access services. I thought it was important to raise up just some barriers that we have then that we see when working with LGBTQ plus older adults. And if you are an LGBTQ plus older adult and this resonates, please let me know. Not everybody was motivated around the idea of thinking ahead. And there's a lot of reasons for that, right? There's survivors' guilt. There's a lot related to the HIV and AIDS legacy that may be a barrier to people actually saying, hey, let me find that senior housing, or let me, get my retirement plan in order. There's a lack of social support. LGBTQ seniors are 3 and 4 times less likely to have children. There's a distrust of traditional systems, I would say well-earned. Many people didn't expect to age and feel invisible in senior systems. These are the top areas of concern for LGBTQ plus seniors: isolation and loneliness. And as an advocate, it's so important to remember you may be showing up to, do some support around the house, or you may be going to that doctor's appointment, but don't forget the fun. Don't forget to help the person feel seen and supported and really enjoy that social time. Housing, which Britta will talk about in a moment. Finances, how am I going to pay to age and age well? Who will take care of me? And where can I find affirming healthcare? These are the primary areas of concern. I think it's important also for people to understand that discrimination and stigma against LGBTQ plus seniors doesn't end just because you get older. Oftentimes people are more afraid because they're going back into housing facilities with their peers, people that made them feel unsafe their whole lives. So LGBTQ seniors, 78% in long-term care feel they cannot be safely out. 23% have experienced verbal or physical harassment. 20% have had abrupt discharge or refusal of admission, and 11% have had their power of attorney disregarded. I wish that we could spend more time on this and that we could go deeper in. I know that Britta will pick up some of these themes, but the reality is that the work is still vast, is still incredibly relevant, and means something in the day-to-day lives of our LGBTQ plus seniors. So how do you show up as an ally? Here's some ideas around communication. Practice affirming communication. Ask how the person likes to be called or referred to. This is really important and a great example of how being inclusive of LGBTQ plus folks actually just makes your services better. For my providers out there, you know that you've had those clients where if you assume Mr. or Mrs., you say, "Hi, Mr. Smith, I'm so-and-so." And the person says, "Well, Mr. Smith's my dad, call me Bob." We make assumptions all the time around communication that doesn't actually serve us. So practice affirming communication. Ask people how they like to be called. Use non-gendered terms like partner or spouse versus husband or wife. And don't assume gender relationship norms. Again, relationships are looking a lot of different ways at the current moment, and we can expect that to continue. So not assuming the status of someone's relationship. Post LGBTQ plus affirming signage. Like I said, it helps people feel safe. You know, when you go to the center on Halsted, you see the rainbows, you see that SAGE accreditation, you see that this is a place where LGBTQ plus people are welcomed. If you don't have language on your website, if you don't have it on your materials, if you don't have it where people can see it, they don't know that they will be welcome there. For those who are advocating for yourselves, plan early, plan often. Use your networks to source trusted providers and resources. If people in your circle have had a good experience, chances are that you may be able to have a positive experience with that provider as well. Bring a friend to any appointments, whether they're housing or medical or financial. It's so important to have someone else in that room with you to be sure that they're asking questions, taking notes, and just moral support so that you feel as confident as you can in those spaces. Invest in friendships of all ages. It is important for all of us to have friends of different ages. And in particular, as we age, investing in younger friendships so that you, again, have a robust community and can combat that social isolation. Talk about the hard stuff. Don't shy away from it. Talk about getting older. Talk about what's happening for you, your fears, your hopes. And use the legal and advocacy resources at your disposal. Groups like those that are on here today, Lambda Legal, SAGE, there are so many resources out there. And on an organizational level, it's really about how we create inclusive communities. As you heard me say with Marcia, it's not that anyone on the staff had ill intent, they were ill prepared. There was no programming, there was no communication within the resident group to say, hey, we are affirming and inclusive, and this is what this means. There were no policies and procedures with teeth to them that they were ready to use. Stay educated on the laws that affect LGBT people. Ask your clients how you can improve. If you are LGBT owned and operated, become certified. Reach out to complementary organizations. No one expects you to know everything. None of us know everything about LGBTQ plus aging. But if we don't know, we know somebody who does. So reach out. Host diversity events and think outside the box. There we go. And this is my final slide, and then I'll pass the mic. What's most important is to be consistent. Ask for consent before you advocate. For example, if I'm working with one of my clients who's trans and we're going into a physician's appointment, I will say, is it okay if the physician or the medical assistant mispronouns you or uses the wrong name? Are you okay if I correct them? Because I don't want them to have to be thinking about that. I just want to have the freedom to be able to advocate in the moment. But you have to ask for consent and be sure that the way you're showing up is the way they want you to show up. Be clear about the ways you can advocate. This is especially important when folks are not feeling their best, right? Because when we're sick, when we're dealing with chronic pain, when we're recovering from a surgery, I can't tell you how to show up for me. But if you say, can I come over and, walk the dog and get your prescriptions for you and, make sure you got a little food. I'm more likely to say yes to that because you've been clear about how you can show up. Affirm what is going well. Remember that social aspect, affirm the relationship, affirm their decisions, and try to be as supportive as possible. Focus on the social and build a team. Active advocacy is about leveraging our resources. I know that if I make a call to a physician's office, I'm going to get a different result. So I want to be sure that if I can do that for my client, I do it. I build that bridge and I make sure that I'm actively engaged in their care. That's it for me. I believe we're transitioning on to Britta.
Great. Thank you so much, Jackie. You're amazing, and you're a tough act to follow, but I learned so much from you. So I'm just going to share my screen. So my name is Britta Larson. I'm Director of Senior Services at Center on Halsted. My pronouns are she, her, hers. And so today I'm talking to you all a bit more about senior housing and long-term care. My background is in long-term care. I worked in a senior living community prior to coming to Center on Halsted. The senior living community where I worked, I won't name names, but it was religiously affiliated. It was very conservative. It was very homophobic. The environment was not welcoming at all to anyone LGBT. So we had about 200 staff who worked there and about 230 residents, and not a single person in the entire community identified as part of the LGBT community. And of course, we were all there, right? But nobody felt safe. And even myself as a staff member, I was in a same-sex relationship at the time. And I thought, if I come out here at work, I don't think I would necessarily be fired, but I feel like the chaplain would have all the seniors praying for my soul every Sunday for forgiveness and that it's not too late to save me. And I just thought, I'm not going to take that risk. And if I'm not feeling safe coming out at work and I go home at the end of the day and I could find a new job if it's not working out, can you imagine what it would be like to be an LGBT resident in that environment who's dependent on staff for care and who's vulnerable and who are not able to just pack up their bags and leave if they're being mistreated. So I think it's really important that we kind of bring this to the center of the conversation. Moving into a long-term care community is not what really anyone necessarily wants or sees in their future, but for a lot of seniors, it is the reality. LGBT older adults are actually more likely to need formal care services for all the reasons Jackie just mentioned. And we still have a really long way to go in making these environments more LGBT inclusive. So just to sort of center us and think about this, I'm wondering if you all can think of someone that who is LGBT and who has been in long-term care. What was their experience? What were they able to be out? Were they able to be affirmed? What factors were at play there? What barriers did they face or might an LGBT older adult face? And we'll talk a little bit more about this, but Jackie just highlighted a lot of great barriers in her slides. So I would say there's three main buckets, if you will, that help people age well or make it a little bit more likely that someone's having a positive aging experience. One is financial security. The second is good health and healthcare. And the last is social and community support. And for all the reasons Jackie just mentioned, these are just much more likely to be harder to come by for LGBT older adults. So they're just more likely to be lower income, a lifetime of discrimination, not planning, for their retirement years for a whole host of reasons. They're still facing discrimination in healthcare or a fear of discrimination, lack of access to healthcare, reluctance to access services that they might be eligible for, and then social and community support. So we're likely to be aging alone. Jackie talked a lot about family of choice, which is something I definitely see with the LGBT seniors I serve at Center on Halsted. But so often your support network is your own age. And so as you are aging, your friends and your family of choice, they're facing challenges as they're aging too. So those intergenerational friendships and relationships become really important. So additional barriers, effects of stigma, both past and present. The need to rely upon families of choice. So our aging network isn't really set up to embrace families of choice. So a loved one is in the hospital and someone goes to visit and the doctor says, "Are you family?" Like, well, no, I'm the neighbor. We're like, well, we can't give you, information. You're just a neighbor. But for LGBT people, family of choice is so important. So I really will take this moment to give a plug for advanced directives and making sure that those are in place. It's especially important for LGBT seniors and unequal treatment under the law. So specifically in the context of senior housing, there are some unique and additional barriers. So as I mentioned earlier, faith-based senior living. A lot of long-term care communities across this country are religiously affiliated or religiously owned. And it doesn't necessarily mean that they're all homophobic or unwelcoming to LGBT people, but it can be a challenge to really embracing the LGBT community. And to Jackie's point, sometimes it's just a matter of they just didn't even see the LGBT older adult in their midst. It hasn't even crossed their mind. It's not even a thought. The cost of senior living. So senior living is very expensive and your options are quite limited if you have limited resources, which makes it even more challenging to find LGBT affirming care. Lack of legal protections, and then finally senior bullying, both of which I'll talk a little bit more about in the next slide. So as Jackie mentioned, the vast majority of LGBT older adults go back in the closet when they move into a skilled nursing facility. And, you can just imagine how hard they fought to come out of the closet in their lifetime. And then to find themselves in a situation where they're very vulnerable and they're dependent on others for care and feeling unsafe. And it's both how they might be treated at the hands of caregivers and the community, but also how they'll be treated by their peers. And that aspect of bullying at the hands of their peers. So this is just a brief map talking about LGBT protections for people in housing. It winds up being sort of state by state right now. And we are fortunate in Illinois that we do have protections for LGBT people. But as you can see across the map, there are many states where there's no protections. So we definitely still have a long way to go in terms of legal protections. And elder abuse, many of us are familiar with elder abuse if we work with seniors. We're mandated reporters, we know this information, but there's an overlay in terms of LGBT people and LGBT abuse. So what that might look like in a long-term care setting is denial of visitors, refusing to allow a same-sex couple to share a room, refusal to place a transgender older adult in an area that matches their gender identity. So, there are sex segregated services in long-term care. Sometimes there are roommates that are paired by gender, and you really want to be making sure that you're matching people based on their gender identity. Keeping partners from participating in medical decision-making, abuse, physical and also psychological, being involuntarily outed. So an LGBT older adult may come out to a provider or someone that they trust, but you want to keep that information confidential and protect that, and only share it with permission. And just another side note around the decision to come out, not all LGBT older adults have the ability to choose when and where to come out. So for example, a transgender older adult, in the process of receiving care in a long-term care setting, they may be outed. And the option for them to choose to come out may be taken away, which puts them in an even more vulnerable situation. Being prevented from dressing according to their gender identity, and also refused admission. And if you're in the audience, you might be thinking, refused admission. I mean, that couldn't happen. It does. It does. And I'll share a quick story. I was giving a training in a rural area of Wisconsin, and I had a hospital social worker share a story. It was 2 trans women who were in a long-term relationship, and one was the caregiver for another. And the woman who was so the one who needed care had Alzheimer's and dementia, and the one who was providing the care was doing well. They were pretty isolated. They didn't have a lot of friends or family. They were going along okay until the main caregiver got a urinary tract infection and didn't seek treatment for it, and then started to have her own health issues. So the fire department became involved. They wound up being placed in a hospital. And the hospital discharge planner, her job was to find a skilled nursing facility for both of these clients. And she called every single skilled nursing facility in the area, and no one would take the 2 trans women. And so they were in the hospital for months while the discharge planner was trying to find somewhere to take these clients, which it's just so sad. We have to do better. So I think that's just a reminder that discrimination is happening. We might not even be aware of it. And in terms of a senior living community, especially in a situation where it's like skilled nursing, where you have very little privacy, no lock on your door, very little ability to choose, have choices and have dignity. An LGBT older adult is in a very vulnerable position for bullying. And, I think we all kind of know what bullying is, but there are a lot of age-related issues that make bullying a little more likely to happen in the context of long-term care. Loss of independence, relationships, loss of valued roles, could lead someone to feeling more powerless. And then someone might be seeking control in a time where they're feeling particularly powerless. And that can facilitate and kind of fuel a bullying situation. And so bullying can look a lot of different ways. I think when we think of bullying, we often think of youth bullying or cyberbullying, but for older adults, that could be shunning, gossiping, spreading rumors, ostracizing someone, especially during meal times or social activities, kind of forming cliques, verbal name calling, insults, threats, physical, and the last item there on physical is actually stealing or damaging physical property, which is something I don't think of as bullying off the top of my head, but in a context of a long-term care setting, you don't have the ability to really secure your belongings. There's lots of reasons why someone might be reluctant to report bullying: fear of retaliation, low self-esteem, poor relationship with staff, feeling like nothing will change, fear of being outed. I do have seniors sometimes report to me that they are being mistreated and they don't want me to report it. They don't want to make it worse. They're afraid of retaliation. And in that moment, I think it's important you just sit with the client, that you're just there and that you are a support, and that you help them and you advocate them in whatever way the client wants you to. There are resident rights for seniors who live in long-term care. And this is just a quick list of how we can interpret these resident rights that are already in place and that already exist in a way to lift up the LGBT older adult and bring forward rights that might be helpful to an LGBT older adult or offer some protection. So, of course, the LGBT older adult has the right to be free from abuse. They also have the right to privacy. So that could mean a private visit with a significant other, right to participate in activities, right? So that LGBT older adult wants to come to Center and Halstead for the Pride Parade, they have the right to do that. Right to receive visitors, be treated with dignity and respect, and to participate in their own care. So some resources I wanted to be able to highlight and share with all of you. So this is from SAGE. They have an LGBT elder housing locator on their website. So you can go onto their website. There's an interactive map. If a state is in orange, it means there is LGBT friendly housing in that state. You can click on it and drill down to find out what that is. In Chicago, we are fortunate to have Town Hall Apartments, which is LGBTQ friendly senior affordable housing, co-owned by Center and Halsted and Heartland Alliance. It's subsidized through the Chicago Housing Authority, so everyone pays 30% of their income towards rent. There's a mix of studios and 1-bedrooms. The wait list is open, but it's really long. So I think it's great that this housing exists. It's definitely needed. It is not going to be the answer for all LGBT older adults who are looking for affirming affordable housing. So I think it speaks to why we need to have these type of conversations to really expand the options available to LGBT older adults. So if anybody's interested in applying, they can just contact Center and Halsted and we'll help them apply. It's through the CHA and it's kind of a complicated process online. There's also something new coming out of SAGE called the Long-Term Care Quality Index, which is exciting. It's the chance to really have long-term care communities take a questionnaire and get a score based on how LGBT friendly they are, and to really drive communities to think about this population, to improve their score. If their score isn't very good, they'll provide additional information and resources on how to boost that score. I get asked a lot for a list of LGBT friendly and affirming places. And that's a difficult question to answer because how do you measure that? So I just encourage people to be an informed consumer and to ask any community, have you conducted LGBT trainings with your staff? That is incredibly important. That really sets the stage for improved quality of services to have trainings. What LGBT programming do they offer their clients? Have they been involved with their local LGBT center? Do they have a pride event? Do their non-discrimination policies include sexual orientation, gender identity? What are their policies about bullying? And so I think it's important to not only be asking these questions, but if a long-term care community doesn't have a good answer or answers no to all of these questions, that consumers feel empowered to say, I will not move in to this place because you're not doing these things. These are important to me, and I will take my business elsewhere. Right. So take your dollar as a consumer and make it known that you will spend it somewhere else, and to really, really drive this culture change movement. Because without that pressure and without that kind of external kind of push, I think a lot of communities won't roll these things out. So we really need to kind of rally together to push and lean in for this. So I've got some resources. The PowerPoint slides are going to go out in an email, so you'll be getting all these resources. So these are some of my favorite, specifically around housing as it pertains to LGBT older adults. All right, that's it for me. I'm about to pass it off to Mike Ziri.
Awesome. Thank you, Britta, and thanks. I am humbled to be in the company of amazing panelists. So thank you for inviting me. Mike Ziri, he, him, his, Director of Public Policy at Equality Illinois. And let me share my screen for a moment, or try to. Great. And I want to talk a little bit about advocacy, legislative advocacy and policy, and advancing equity and inclusion through those processes. And I'll say, Will, your earlier point about contacting, I believe it was Senator Feigenholz, and then working with your member of the City Council, all well taken. And as someone who does work like that with legislators, I can say that for everyone listening, you have so much power to impact policy changes. whether you are an LGBT older adult or a service provider, a family member, a friend, an ally. You have so much power to make change when it comes to policy at the city council or at the county board or in Springfield at the state capitol. And even in Congress, at the federal level. And we'll talk a little bit about some of those pieces, but can't emphasize enough the power of your personal story to make change and to build that better Illinois that we all want to get to. And we talk about equity and inclusion, and laws don't solve every problem, but laws are foundations to build the better Illinois. Britta talked about non-discrimination protections. Those protections are they provide the foundation to build a better Illinois to go forward. And I'm going to talk a little bit about a law that a bunch of us on this panel worked on a few years ago, and then some legislation this year in Springfield, and then a really big piece of legislation out in Washington, D.C. right now. But I want to echo, as we talk about these bills and these laws, I want to echo Jackie's point earlier, that is, providers, be prepared. Be prepared to provide affirming care, inclusive care. And these laws will help you do that, I think. And I just want to jump right then into a really exciting bill, now law, that we passed 2 years ago. And Kim mentioned it earlier, the Senate Bill 1319, which is now Public Act 101 325, I believe. And it's the bill to advance equity for LGBT older adults and older adults living with HIV. Really exciting initiative of Pride Action Tank, Equality Illinois, SAGE, Senator Halstead. And we passed this in 2019 with strong, I believe, unanimous support, almost unanimous support in the Illinois House and unanimous support in the Illinois Senate. And very simply, it does two things. One, designates LGBT older adults and older adults living with HIV as communities of greatest social need for inclusion and aging programming. And it establishes non-discrimination protections in assisted living and shared housing facilities, protections which are already or were already in Illinois law for nursing homes. And I would be remiss if we didn't tout that Illinois was the third state to designate LGBT older adults as communities of greatest social need. California and Massachusetts were the first two, but we were the first state to designate older adults living with HIV as a community of greatest social need. So we can be really proud of the work that's happening here in Illinois. And this bill came from conversations with Kim and Aaron Tax from SAGE and others about the need to make sure our laws were fully affirming and supportive of LGBT older adults and older adults living with HIV. And it was also, as Jackie mentioned, the experiences of Marcia Wetzel and seeing how Marcia was treated and wanting to make sure that our laws are as robustly protective in Illinois as possible. And that's how this bill came about. I know Kim joined me in Springfield to testify at the House committee. And then our friend Serena Worthington joined us on the Senate committee. And it was just so awesome to get this bill passed. And now, what does it look like? What does this mean? What does it mean in practice? Because we aren't just passing laws just to have nice laws on the books. We want actual implementation. And what that looks like is that, for the area agencies on aging and service providers, it means that you should and must, when you develop your programming with an eye to being inclusive for LGBT older adults and older adults living with HIV. So we can counter some of the issues and experiences and trends that previous speakers have talked about. And I just can't emphasize enough that as you do this, reach out to us on this panel. We want to be helpful to you to help you with your policies or particular programs or data collection, which I'll talk about in a second. As you do these initiatives that recognize the needs of LGBT older adults and older adults living with HIV, we want to be helpful. So reach out to us. But more importantly than that, as you do this work, please center those communities in your work. and listen to what those communities, the LGBT older adults and older adults with HIV, are saying what they need, and how that programming looks. The programming could be different in different communities, but this law is directing you to be inclusive, to be equitable, and to make sure that your services and programming are meeting the needs of LGBT older adults and older adults living with HIV. It's an exciting bill, now law. I keep saying bill. I'm so conditioned to say bill, but it's an exciting law. And we've been speaking with the Department on Aging about how this can be implemented, and just really exciting for what can go forward. I will say the bill passed in 2019. The pandemic has knocked off our implementation and outreach and education plans a little bit, but I think there's so much we could do to get the word out. And I already know the Department on Aging is doing some good work around implementation and making sure their policies are inclusive, their data collection is inclusive of sexual orientation, gender identity. But we are here as a resource to help you implement this. So please call upon us. But I mentioned demographic data collection, and that's something that we're working on this year as well with everybody, on this call. And this conversation around demographic data collection at the state level started last summer or fall, when a few organizations, Equality Illinois, Pride Action Tank, Center in Halstead, I can't remember everybody, but it's an awesome group of advocates and organizations, Howard Brown Health, of course, AIDS Foundation. We started thinking that when it comes to sexual orientation and gender identity, data collection as part of COVID testing and treatment and vaccinations, providers aren't consistently asking data questions around sexual orientation and gender identity. Then that snowballed into a bigger conversation around, well, nobody is really asking about sexual orientation, gender identity in a consistent way. And if you want to have data that you can use over time to tackle disparities in healthcare, in aging programming, in all kinds of state and government services, you have to have consistent data. And so we noticed that, we looked at that, we talked to partners from Pennsylvania, from Nevada, from California, who are in some form or another doing sexual orientation and gender identity inclusive demographic data collection. California passed a law. Pennsylvania is doing it through the administrative side, through the executive branch of the state government. But we heard from those partners across the state about how this is being done. And so in February, we, with our great state senator, Mike Simmons, introduced a bill that would do two things. And the bills, we're talking to stakeholders still. We're figuring out how to make the bill as strong as possible to get that data that we want. But it would require hospitals to collect demographic data around COVID testing, treatments, and vaccinations. So really going to the issue of disparities and the pandemic. But then when we thought about that broader sense, we looked at state agencies who provide, as you know, tons of services to the people of Illinois, and looked at those services and those state agencies. And there actually is a new law that requires some demographic data collection. So what we've done is we've expanded that law to include sexual orientation, gender identity, but also data collection around age, disability status, national origin on participants in state programs. And it's really exciting because I'm going to look at the fact sheet real quick. It's 11 or 12 state agencies. So it would affect the Department on Aging, the Department of Central Management Services, the Department of Children and Family Services, the Department of Corrections, the Department of Juvenile Justice, the Department of Labor, the Department of Healthcare and Family Services, the Department of Human Services, the Department of Public Health, and the Department of Transportation, as well as the State Board of Education. So if our bill, Senate Bill 2133, were to become law, those state entities would have to start, including sexual orientation, gender identity data collection as part of their overall demographic data collection. And that's exciting for all of the reasons I mentioned earlier. So we can finally see in Illinois what healthcare disparities look like. What do disparities look like in education, in transportation planning, in corrections, in the prison system, in the juvenile justice system, and then be able to use that data to tackle some of those problems and make sure that resources from the state are being effectively, targeted to support LGBTQ people who are experiencing these disparities. So really excited by this bill. There's, like I said, there's still more work to do, but I think we're headed in an amazing direction. We've got great partners, we've got a great sponsor, and we're finding interest from allied organizations to get this done. So really excited about that bill. And this is currently, unlike the previous bill, the Equity for Older Adults bill, this is a bill. It's not law yet. So if you want to help us get this passed, we would love that. But we also know, as we think about data collection, we're only focused so far in Illinois. And there's some movement happening this year in the United States government. And in particular, you saw Britta's map earlier that most states do not have non-discrimination protections, not just in housing, but in public accommodations, in access to credit, in hate crimes, in so many areas. Most states do not have legal protections. And one thing I've been asked by reporters sometime when we talk about the lack of protections in other states is, well, why do you care as an Illinoisan? You have the Illinois Human Rights Act. It protects LGBT folks from non-discrimination or from discrimination. Why do you care? And I care for two reasons. One, Illinoisans do not just stay in Illinois. Illinoisans travel. And when you talk about housing, that includes public accommodations and hotels. It includes apartments. You talk about public accommodations, that's going into a restaurant or a bar, and the potential for it to be in many states legally refuse service. But in addition to why it should matter to Illinoisans, we should all strive to live in a country that has a law that affirms and protects LGBT folks everywhere in the country. And your rights should not be based on your zip code. And that's why I just want to mention briefly the Equality Act, which is really key legislation that just passed the US House about a month ago. It's in the US Senate right now. It would expand those enduring national protections, non-discrimination protections for LGBT people across the country to every state. And what's covered by that? There are 6 or 7 areas protected by the Equality Act. 1, housing. We've talked about today, housing protections. 2, employment protections. 3, those public accommodations, restaurants, bars, those services that we use every single day, as folks who live in public spaces. Jury service protections, which I know we all want to be non-discriminated in jury service because we all love jury service, but also non-discrimination in schools, non-discrimination in access to credit, and non-discrimination in programs that are funded by the federal government. And that could be adoption services. It could be the Older Americans Act. It could be any variety of services that might receive federal funding, to making sure that there are non-discrimination protections enshrined in that. So the Equality Act, really important piece of federal legislation. And we just think the US Senate should pass it as quickly as possible. We already know the president would sign it. And I will say in Illinois, we are fortunate to have both US senators as champions of this legislation. But again, this would, hugely impact LGBT older adults across the country, not just in Illinois, but across the country, to have those enduring protections to really be able to combat some of that stigma that Britta talked about in housing and access to housing, access to affirming housing. When you talk about long-term care facilities, for instance, or getting an apartment. Any kind of advocacy you want to do or can do for the Equality Act, particularly if you might have friends in other states, it'd be so important. And I would be remiss talking about advocacy if I didn't share opportunities in the next 2 months for you to advocate. So I want to highlight our partners at the AIDS Foundation have Illinois HIV Advocacy Week coming up, April 19th through the 23rd. And you can go to their Facebook page and find the information, sign up. So that's coming up to advocate for good policies in Springfield. And then we at Equality Illinois on May 12th have our virtual advocacy day, and you can go to our Facebook page and find information about signing up there. I can also drop in the chat the registration links for HIV Advocacy Week and our virtual advocacy day in May. So no excuse not to get involved. Like I said, your stories have so much power and impact as LGBT older adults, as service providers, as friends, as family members. But I thank you for letting me, speak for a little bit here. And I want to turn it back over to Kim.
Thank you so much, Mike. And thank you to Britta and to Jackie and to Will. Just an amazing amount of information has been shared here today. And folks asked if the slides will be available. They will. We will send the slides in a follow-up email. And someone else asked about how they can help this legislation get passed. You named that, Mike. Thank you for putting the advocacy information up there. So I have a few questions based on the discussion, and if others have more questions, feel free to put them in the chat. We may not be able to get to all of them, but if you have a question we don't get to, we will follow up via email, or we'll include that answer in our follow-up email. So first question for Jackie. You listed several terms for sexual orientation and gender identity. And one of the terms that, every time we have an aging panel, we spend a little time on is queer. It's a word with a lot of stuff with it. Do you want to address that for just a few moments? Just for folks who don't know. I know this could be a day-long conversation by itself, but.
Well, thank you, friend. I appreciate that, because I realized as I was speaking, I mentioned queer, and then I didn't follow up with the disclaimer that, okay, so here we are. This is a perfect example of really how our language changes and evolves, and that we as providers and as folks that care need to consistently be engaged in these conversations, because the term queer, when I was coming up, meant something very different than what it means and still means for many LGBTQ plus seniors. So there's many organizations actually don't use the term queer or don't use the Q in their marketing and in their communications, because so many LGBT seniors have had negative experiences. That word by itself was highly, highly stigmatized and highly weaponized. And so many people have the lived experience of that word being a really derogatory term. When I was coming up, that was not the case. And so I have had a different perspective about what that word means. And so it's a discussion that is constantly going on. And if you are working with LGBT seniors, it's a topic to talk about and see what your group comes to a conclusion around, and respect what the wishes of the LGBT elders are in the room, would be my suggestion.
Thank you for that, Jackie. Words mean things. We need to make sure that we are on the same page. I appreciate that. Britta, you shared a list of rights that older adults have for housing. Where do those come from? Are they in a single Bill of Rights, or where can folks find those rights?
Sure. So these rights specifically pertain really to skilled nursing facilities, and they are rights that are sort of codified. So it's something that communities skilled nursing facilities have to follow. So there's rules that skilled nursing facilities must train their staff on these rules annually. And staff must be following these. And if they're not, there's action that can be taken. And so in my PowerPoint, I had a hyperlink to a document that really takes these resident right rules and interprets them sort of from an LGBT lens. So how you can apply the right that already is in, in the rules and in things that nursing homes have to follow, how you can kind of have an LGBT lens through that. So it's already in the code. So they already have to be doing this.
No, good to point that out. And Mike, just going back to SB 1319 for a little bit, someone wanted to clarify, this includes LGBTQ and HIV status, two separate groups, or can be the same, right?
Right.
So, but they don't have to be the same. And also long-term care facilities in general, are they included, or is there a distinction?
So for the first, well, there's two parts to the bill. I'll tackle, I think, the second piece, which is the non-discrimination protections in assisted living facilities. So we put that in because there's already similar language in the Nursing Home Care Act. So generally, long-term care facilities, these protections, these non-discrimination protections apply. And to be clear, when we put the piece for assisted living facilities in, it doesn't just say you can't discriminate on the basis of sexual orientation, gender identity. It's a whole group of protected classes and categories, race, ethnicity. So it's very comprehensive. But I am always up for looking at our laws to make sure that they are robustly protective as possible. And just listening to Britta here talk about what the protections are and the rules are for skilled nursing facilities makes me wonder if we need to look at other facilities for bills of rights and things like that. So always thinking of those ideas. But you're right on the first part of the question. When it comes to people living with HIV and LGBT older adults, yes, the programming should be cognizant and inclusive of both communities. And sometimes you're right, there is overlap, but not necessarily so. So programming should be inclusive. And the reason, what the definition of greatest social need is, it's rooted in the Older Americans Act. It's a definition that is born out of the Federal Older Americans Act. So we're talking about programming that could be provided through the Older Americans Act. But I think it's also, as I mentioned earlier, that laws are foundations for building a better Illinois. I think every provider should look at this law and say, I need to be intentionally inclusive, intentionally affirming, just saying, okay, I'm going to invite some LGBT older adults to this event that I'm planning for everybody, that may not cut it, because as we've heard, LGBT older adults will have unique needs. People living with HIV will have unique needs that might not be met with a general event. So you think about particular programming that doesn't just include those communities, but also does the work of outreach as well, and intentional outreach. I mean, you could throw something on a Facebook page and say LGBT, event, but if you don't do the extra step of the outreach, you may not get a response, or the response that you need and that folks want and need as well. So that was a long rambling answer. I hope that was helpful.
That was helpful. Thank you. I love your ramble. It's always good. And then last question before I turn it back over to Britta. The SOGI data collection bill, game changer, very exciting, we know. Folks can also be asking these questions now. They don't have to wait for the law to pass, but we would like to point out that, you can't just ask the question. There are ways to ask. So can anybody point to some resources for ways that folks can ask these questions in a manner that is not stigmatizing and does not do more harm?
Yeah.
People are concerned about.
Yeah, absolutely. And there's some great resources. I am first going to, and maybe we can do a follow-up email after. I think we're going to do a follow-up email to everybody who registered. But the task force that I mentioned, Equality Illinois, Pride Action Tank, Howard Brown, et cetera, has actually done 2 virtual panels/town halls to talk about the issue of demographic data collection and why sexual orientation, gender identity data collection is important. And those were both recorded. One was in November one was in January. So I think those are excellent resources for folks to watch and listen to. I think they're about an hour a piece, maybe. So those are excellent resources. But I would also say turn to partners like Howard Brown, like the Center, like the Care Plan, folks, organizations and entities who have expertise in asking these questions and understanding the ramifications of questions that are asked badly. So I think, there's great resources out there. Also, if you want something national, what other states are doing, Fenway Health in Massachusetts is another great resource. We can look at what California is doing. And I remember in our last task force meeting about a week ago, I think someone mentioned that Northwestern was going to be coming out with a report or some data around the best ways to ask some of these questions around sexual orientation and gender identity. And I would just say, to Kim's point, please, before you start asking the questions, engage with these organizations, just to make sure it's being done in a affirming and supportive way.
Thank you.
Kim, I'll just mention, I put in the chat that SAGE, the National Resource Center on LGBT Aging, has a best practice guide on asking inclusive questions. And it really is great. It gives, great examples on how an organization might go about doing that.
Thank you, Britta. And you can keep the mic.
Oh, sure. All right. So in our final 2 minutes, I wanted to just give an open invitation to everyone on the call today to consider joining the Chicago Network for LGBT Aging. Both Jackie Boyd and myself are co-chairs, along with Matt Vale from Rush. And it's a really small, it's a grassroots group, but it's based in Chicago. But since things are virtual right now, doesn't matter where you live. We have a Google group, and the group is always posting information, resources, trainings, research studies, you name it. It's a really active group. The group meets quarterly. And so if you are all interested in joining, all you have to do is just send me an email. I'll add you to the listserv. I'll put my email in the chat right now, so you all have that. And just shoot me an email and I'm happy to add you. It's as simple as that. Making sure I spelled my email right. I think I did. And then another just quick housekeeping note: if you are on the call today and you are wanting CEs for this, there's an evaluation that you will need to fill out. So we're going to put a link to that in the chat that you can access that way. Also, there will be a link in the email that will go out shortly after this presentation. So if you're interested in CEs, you must fill out that evaluation. I think that was all my housekeeping notes, housekeeping tasks. So that's it. Thank you all so much for joining us today. It was such an honor, such a pleasure. Keep up the great work. Keep advocating for our LGBT older adults. And thank you for joining us.